there was an outcry for a long-term care center in our community because we were having to send all of our residents to other communities.
You know, our tribe has done a very good job of is to listen to the community, listen to the needs, and to try to understand where the movement of the community is going.
Our families were having to send their loved ones outside of the community, and so visitation was hard on the families. They didn't have that extended network of support, and so they propositioned leadership and challenged them to create a long-term care center.
We have certain services here that we provide to the community under home health. We have 4 different programs that I oversee. We have aid services, we have a respite program, we have CAP services, and we have skilled nursing care, which includes physical therapy and in-home nursing.
We made a very concentrated effort to reach out to the state rather than relying on them to come to us. We established rapport with our Secretary of Health at the state level and asked for his assistance in creating some liaison with the State Department of Public Health, with CMS, the Division of Medical Assistance, and then we created networks of friends, basically. And so invited them to our community. That was the first step, was so that they could see what services are here and the good work that we're doing. And that's more convincing than anything. And then we helped them understand what FMAP was. And I think that was a huge step.
The state is a very important tool for us. Even though we are a federal tribe and we are a federal agency, the state Medicaid funding, the state support that we have is crucial, I think, to a successful home health agency.
Well, we're fortunate also in our community to have our own hospital, and the hospital is run by the tribe. And so we have a continuum of care in our community that we're very fortunate to have. We have inpatient services from our facility. We have ambulatory clinics. And so we have a really joint system, really robust system of networking to refer patients from one continuum to the other.
I do know that sitting down with the Medicaid representatives and the PCS program, that we have a very good relationship with that organization, and we're actually looking to add another program to support our community in the near future.
The best advice I can give is your tribal leadership has to first of all understand what the real issues are in the community, but also have to be committed to developing services that are going to address each one of these issues specifically and as a whole, not just short term but long term.
Large percentage of our staff are enrolled members of the Eastern Band, and we would like for all of them to be, quite honestly, because then we have family taking care of family.
Here I feel like on a reservation, if it wasn't here, they wouldn't want to go to a nursing home or be in a care place. But here, everybody feels like that they can come and see one another and communicate with one another very well.
It's really overwhelming. The desire of this tribe and its leadership to care for its elders. And it's made it a pleasure to work here.
They feel like that they have a resource that they can come to. The tribe puts a lot of effort in everything. They really follow up on a lot of stuff to see what needs to be done. If there's other tribes, I would like them to come see this and see how it is operated, because frankly I believe like they're doing a wonderful job.